We're diving into the often overlooked world of blood pressure measurement. Specifically, we're exploring a study that reveals just how much the position of your arm during a reading can impact the results.
This crossover randomized clinical trial that you're talking about called the ARMS crossover trial, it really does highlight the significant impact that arm position can have, and it was recently published in the JAMA Internal Medicine Journal.
The study involved 133 participants in Baltimore, Maryland, and each participant had their blood pressure measured in 4 different arm positions.
So researchers used a position that they called desk 1 as a reference point, and this involved the participant's arm being supported on a desk at heart level, and then they compared this to readings taken with the participant's hand resting on their lap, their arm hanging unsupported at their side, and then they took a repeat measurement with the arm back on the desk in what they called the desk 2 position.
And what makes this study so compelling is that it really examines positions we encounter all the time in doctors' offices and even at home.
And the results are significant enough to make us all think twice about how our blood pressure is being measured. So when the arm was resting on the lap, both systolic and diastolic blood pressure readings were higher than the reference measurement taken with the arm on the desk at heart level.
To be more precise, the study found that systolic blood pressure was overestimated by 3.9 millimeters of mercury, and diastolic blood pressure was overestimated by 4 millimeters of mercury when the arm was in that lap position.
That's millimeters of mercury, or mmHg, the standard unit for measuring blood pressure. And these seemingly small differences could actually push someone into a hypertension diagnosis when they might not actually have high blood pressure.
And the overestimation was even more pronounced when the arm was hanging unsupported at the side.
In this position, systolic blood pressure was a full 6.5 millimeter Hg higher, and diastolic blood pressure was 4.4 millimeter Hg higher compared to the reference measurement.
So the researchers suggest several reasons for why arm position can have such a noticeable effect on blood pressure readings.
One factor is hydrostatic pressure, which is essentially the force of gravity on the blood in the brachial artery. So when the arm is below, the heart gravity makes it harder for the blood to flow, so the pressure in the artery increases.
So the lower the arm, the greater the hydrostatic pressure and the higher the blood pressure reading is likely to be.
Another contributing factor is something called venous return, which refers to the flow of blood back to the heart. When the arm is positioned below heart level, venous return is reduced, and this can lead to a buildup of blood in the arm.
And this can lead to vasoconstriction and narrowing of the blood vessels, which further increases blood pressure.
Additionally, the study points to muscle tension as a potential factor, especially when the arm is unsupported at the side or even resting on the lap.
So even subtle muscle contraction can elevate blood pressure readings, making them less accurate.
And it's important to note that these seemingly small discrepancies in blood pressure readings can have a significant impact on how hypertension is diagnosed and managed.
And the study authors estimate that millions of adults in the United States alone could be misdiagnosed with hypertension if their blood pressure is consistently measured with their arm in the wrong position.
And this misdiagnosis can lead to unnecessary medication use with potential side effects, not to mention increased anxiety and healthcare costs.
The study highlights how important it is to stick to those recommended guidelines for blood pressure measurement, even in busy clinical settings.
You know, those guidelines recommend that the arm be supported at heart level on a desk or table during the measurement. This helps to minimize the influence of hydrostatic pressure and venous return on the readings.
And it also helps to ensure that the arm is relaxed and free of any muscle tension.
But the study found that this guideline is often overlooked in practice.
Yeah, the researchers actually observed healthcare providers frequently measure blood pressure with the patient's arm just resting on their lap or even hanging unsupported at their side.
And these seemingly minor deviations from the recommended procedure, they can have significant consequences for the accuracy of blood pressure readings and the subsequent diagnosis and treatment decisions.
This raises the question of what can patients do to ensure their blood pressure is being measured correctly?
Well, patients shouldn't hesitate to ask their healthcare providers about how their blood pressure is being measured.
They should feel empowered to request that their arm be properly supported at heart level during the measurement.
It's also important for patients to be aware of the potential impact of arm position on blood pressure readings if they're monitoring their blood pressure at home.
A lot of people use those automated blood pressure monitors at home, and it's crucial to follow the manufacturer's instructions carefully to ensure accurate readings.
This includes paying attention to arm position and support.
The study's findings also have some implications for the development and refinement of blood pressure measurement devices.
So device manufacturers, they should really strive to design monitors that minimize the impact of arm position on the readings.
For example, some devices may incorporate features that alert the user if the arm is not properly positioned, or that adjust readings based on arm position?
This arms crossover trial has really brought to light the importance of revisiting even the most routine medical procedures and ensuring that they are being performed with the utmost accuracy.
It really underscores the need for ongoing education and training for healthcare professionals just to reinforce the importance of proper blood pressure measurement techniques.
And the study's findings also highlight that crucial role that patients play in their own healthcare.
By being informed and engaged, patients can really advocate for themselves and ensure they receive the most accurate diagnosis and treatment possible.
Ultimately, this study serves as a reminder that even seemingly small details can have a profound impact on health outcomes.
By paying attention to these details and working together, healthcare providers and patients can strive to achieve the highest standard of care. This study really emphasizes the need for clear communication between healthcare providers and their patients about blood pressure measurement.
Healthcare providers should be explaining the procedure thoroughly to their patients and emphasizing that importance of proper arm positioning and support.
They should encourage patients to ask questions and express any concerns they may have about the whole process.
Yeah, patients who are actively involved in their healthcare and really understand the rationale behind specific procedures are more likely to adhere to recommendations and actively participate in their treatment.
The study also suggests the need for system-level changes within healthcare settings to ensure the accuracy of blood pressure measurement.
Healthcare systems could consider implementing standardized protocols for blood pressure measurement, including specific instructions on arm position and support.
Regular training sessions and educational materials can help to reinforce these protocols and ensure that all healthcare professionals are following those best practices.
Absolutely, and quality improvement initiatives that monitor and audit blood pressure measurement practices could also help identify and address any inconsistencies or deviations from the established guidelines.
This kind of proactive approach can lead to more consistent and accurate blood pressure readings across different healthcare settings.
This arms crossover trial serves as a compelling reminder that even the most routine medical procedures need ongoing evaluation and refinement.
It underscores the importance of staying up to date with the latest research and challenging those assumptions about existing practices.
By continuously seeking ways to improve the accuracy and reliability of medical procedures, we can ensure that patients are receiving the most appropriate and effective care possible.
Well, this deep dive into the impact of arm position on blood pressure readings has really highlighted the significant implications of a seemingly simple detail.
It really does, and the study underscores the importance of adhering to guidelines, promoting patient education, and implementing those system-level changes that we talked about to enhance the accuracy of these readings.
By taking these steps, healthcare providers and patients can work together to achieve more reliable blood pressure measurements. And this will lead to more informed diagnosis and treatment decisions, and ultimately, better health outcomes for everyone.